Good morning and welcome to this episode of Monday Morning Mobility. I'm Jeff Blanchard and I'm a physical therapist, and I'm here to help you from my standpoint. My goal is to help you be able to improve your quality of life by teaching you how to decrease your pain and improve your ability to move. Today's topic is jaw pain. So jaw pain is something that physical therapists can treat, and I've found that many people are oftentimes surprised that physical therapists work in this area. But the jaw is attached to the cranium or to the maxilla at a joint. So you've got a joint on both sides. And so that falls within the realm of what we do in physical therapy. And but there are many therapists who aren't trained in treating this area. So if you do have jaw pain, you want to make sure that you call where you're going to go and find out if there's a physical therapist there who's trained in treating this area. So I find that jaw pain can affect teens all the way through the span of life. Sometimes the pain will come on for no obvious reason that you can come up with, and sometimes there's a definite reason. You've been in a car accident, or maybe you get hit in the head by something. Maybe you're playing a sport and a ball hits you in the face, and then you have pain afterwards. And oftentimes what people will say is that they notice that they start to get clicking in their jaw, and then the clicking will maybe become painful, or maybe the pain comes on first and then it turns into clicking. And so then they aren't quite sure what to do. They go see their dentist. Oftentimes the dentist will do a splint that they can wear at night, a night splint. Sometimes that helps and sometimes it doesn't. So I think the most important thing is to figure out what's going on, and that's why you would go see a physical therapist. So we're really the best people to be able to do a thorough examination, to be able to tell you what's going on in the jaw that's causing your symptoms. So jaw pain can come from muscle, or it can come from the joint, and or the tissue around the joint. And there are some tests that we can do to determine if it's coming from muscle or from the joint. If there's popping involved, then something's going on at the joint level that is creating that noise. So the joint at the jaw has a disc in the space, and so the jaw comes up to a point, and then above the bone there's a disc, and then that disc rests inside a little, what we call a fossa, or a little kind of a recess. And as we open, the jaw glides forward, and the disc is supposed to glide forward with the jaw. And then when we close, the jaw then goes back and the disc goes back to where it's supposed to stay. So the goal is that your body helps that disc stay between the jawbone and the kind of the socket that the jawbone sits in. So as you open your mouth, about the first 20 degrees is what we call a spin, which is the jaw moves in the socket kind of like that, but it doesn't move out. So that's about the first 20 millimeters, not degrees. So on average, people can open the jaw about 40 to 50 millimeters of motion. So if you were to measure between your teeth, you would see that distance. So about the first 20 millimeters, a little less than half, there's that rotation occurring. Then in order to open wider, then the bone starts to slide forward. So if the mouth is opening that direction, the jaw opens and slides forward. That gives you even a bigger ability to open. And that's usually where the problem occurs. So the disc is supposed to go with the bone as it opens. Well, so what happens is usually there's some kind of an injury that causes the disc to slip forward and stay out of where this joint is. So here's the disc and here's the joint. When you start to open your mouth, the disc slips back in, and that's the click that happens when you open your mouth. It is actually the disc popping back into place between this bone and this socket. And then when you close your mouth, there will usually be a quieter click as the disc pops right back out of the space again and sits out here in front. So that's what's called opening with reduction. Reduction means that the disc is reducing, or it's going back into the space as you open your mouth. So there's that click. So now oftentimes with an injury, a blow to the face, it can cause the disc to pop out. If you go and see somebody who knows what they're doing and can tell the disc is out, they can typically get that joint to open up and have the disc pop back in. That's what we want. That needs to happen within the first few days, maybe a week or two. The longer the disc is out, the more the tissue on the back side of the disc will stretch and stretch and stretch until there's no more pull to pull that disc back in. So the disc is attached to like a rubber band tissue. If that rubber band gets all the way stretched out, the disc comes forward, there's no more pull for that rubber band to pull the disc back in. So then the disc pops back in only when you open your mouth up. And the disc kind of slips back in, but then when you close your mouth, the disc slips back out. So what our goal is in physical therapy is to try to help with that process, help to try to get the disc to be able to accommodate in its space better, see if we can lessen the click or eliminate the click, and then work on exercises to be able to train the muscles to be more stable, and so there's less inappropriate movement going on, which causes more click. It's oftentimes the louder the click is, the more trauma is occurring in the area, and then we get inflammation and we get pain. So that's one scenario. Another scenario might be that the mechanics of the jaw aren't very good, and maybe certain muscles are working the wrong way or working too much, and then we start getting muscle pain. That can lead to headaches, and then there's also a neck component. So the position of your neck and your head can directly influence the jaw. So if you're looking at me from the side, and we've gone through this before, if you have a forward head posture, then in that position, there is more pressure on the joint and more pressure in the muscles to hold the jaw up. And so that pressure will increase pain and increase headaches. If you have better posture, then the jaw is actually balanced in place and you don't have to work as hard to hold the jaw up. So there are multiple things that can contribute to jaw pain. Many of those things maybe are not seen by a dentist or a doctor that you might see. So the best thing to do is to find out if there's a physical therapist in your area that treats this area and who can do a thorough evaluation to be able to tell you what's going on, and so they can then get you back on the road to recovery. Thank you again for joining me for today's episode of Monday Morning Mobility. If you've enjoyed today's episode, please share it. Please leave me a review. If there's a topic you'd like to hear about, please let me know. But until next time, keep moving because motion is lotion.